Hip problems are on the rise, and so are hip replacements. At the same time, doctors find themselves treating younger, more active patients who would like to find a simpler way to ease their pain. Here's the latest in this week's Positively Healthy. Given the option, most patients would like to avoid a total joint replacement. Now, when it comes to the hip, some of them may be able to sidestep a major operation.
What we do typically is find patients who are on their way to developing hip arthritis. And that usually occurs as a result of either a torn cartilage in the hip or a slightly misshapen ball or socket that leads to abnormal contact between the bones. What happens then is those patients go on to develop hip arthritis relatively rapidly, and they're more likely to need a hip replacement before the age of 55.
On average, they're younger patients who typically present with groin pain that gets worse with activity and better with rest.
That pain will continue to increase until it's present nearly constantly.
If caught at the right time, doctors may be able to ease their suffering through the use of hip arthroscopy.
Hip arthroscopy is essentially placing a camera inside the hip joint, and it allows you to treat conditions.
Using a small camera and surgical tools inserted through small fingernail-sized poke holes, doctors go in and repair the damage.
We'll change the shape of either the ball or the socket to prevent the bones from hitting each other. We also have something that's equivalent to drywall anchors. It goes in the bone, it expands, and it has sutures in it and allows me to repair the torn cartilage.
One or all of these can be performed in a single, relatively brief procedure. While it's still fairly new, the hipper option comes with a lot of optimism.
We're starting to see these outcomes now, and we're starting to have the long-term data. And from what we see, this is very effective in reducing the need for hip replacement in appropriate patients.